Hi, Dr. Yass here. This video is for all those millions of people out there who are specifically suffering with lower back pain. For most of you, you have gone through the medical establishment, gotten an MRI, and been told that the cause of your lower back pain is related to some structural variation in the lumbar spine, a herniated disc, stenosis, arthritis, spondylolisthesis, some crazy sounding medical term that relates to your spine. Here's the answer. It has nothing to do with that. You've had that for years, way before you ever even had your symptoms. And the fact is that as many people without symptoms have the same structural variations identified as the ones you are being told are the cause of your pain. So if as many people who don't have pain have the same structural variations, how could you say that it's causing your pain? The more likely solution is that another tissue in the area is causing your pain, and it's only because that tissue is eliciting your pain that you got your MRI and found the structural variation while you were having pain. That's the big jump that most people are having difficulty recognizing. Sure, lots of people can have structural variations identified while they're having pain, but if you then find that as many people who don't have pain have the same structural variations, it calls into question whether these things are even causing pain, which they are not. So for all those people, and I'm talking globally, it's millions of people suffering from lower back pain. The answer is most likely that your psoas or hip flexor muscles have shortened, or your lower back muscles have shortened, and they are straining and eliciting pain. And quite simply, if the pain is fairly centralized, very close to the spine, you could assume that that's your psoas muscles, which actually attach to all 5 lumbar spine. If it's more 2 to 3 inches off the side of the spine, then it's most likely your lower back muscles, your quadratus lumborum, shortening and eliciting the pain. So the answer quite simply is the fact that the muscles in the front of the pelvis and the thigh, the psoas and quads, are much stronger than the gluteus maximus, your butt muscle, and your hamstrings. So if you want to resolve this imbalance and take away that excessive arching that you see in your back, and if you are having this problem where if you sit for a while and then you go to try to stand up, you find it very difficult to stand fully erect or to prevent yourself from arching. It takes a little time and eventually then you can do it. Those are all indications that has nothing to do with any structure, that it's muscular. The simplest solution, strengthen your butt muscle. I mean, this sounds insane and hard to imagine, but strengthening your butt muscle will resolve your lower back pain. One of the things that might be concerning to you or might sound different than anything you've heard is because for the thrust of the planet, when you hear about muscular pain in the lower back or muscular deficits in the lower back, you hear about core, strengthen your core. Let me make this clear. Dr. Mitchell Yass is telling you that the premise of core strengthening is bullshit. It's meaningless. Number one, the abdominal sheath that supports the abdominal cavity has great difficulty even holding the organs in the cavity, let alone providing support or stability to the lower back. Strengthening your lower back muscles, because they are so much stronger than the abdominal sheath, will only cause them to shorten further, increasing the arching. So neither of those two are a logical solution to resolving your problem. The answer is that the cause of the excessive arching and the lower back pain relates to an imbalance that occurs below the line of the lower back. And since the lower back muscles attach from the rib cage to the pelvis, a variation in the position of the pelvis is what will allow those muscles to shorten and strain. And that relates to this imbalance that I just discussed regarding the psoas or hip flexor muscles in the quads versus the gluteus maximus and the hamstrings. And I would suggest that the primary muscle that can offset this imbalance is, strangely enough, your butt muscle, your gluteus maximus muscle. And the two primary exercises to perform are hip extension or straight leg deadlifts. Hip extension is an isolated exercise where you are moving one joint in one direction, which is hip extension, and that does, with the knee bent, allows you to isolate the gluteus maximus. Straight leg deadlifts is a more complex exercise, but it will get the gluteus maximus and the hamstring, which are both hip extensors, which both can help to offset the imbalance. But I personally believe that the gluteus maximus, because it's in its best position to create that hip extension and offset the hip flexion component of what would happen if your hip flexors, your psoas or the quadriceps, are too strong in relationship to the gluteus maximus and hamstrings. All right? This is a short one, but I want this to be clear. I want this to be as simple as possible. You got lower back pain. You see you're having an excessive arch. You got to assume the back pain is coming from shortened muscles in the back due to an imbalance, where the muscles that would prevent arching simply are not strong enough. And by the way, when we talk about another common, you go to physical therapy, they give you bridging. Bridging is worthless crap. Number one, you're not going to get a lot of range of motion. Number two, you're going to be using a lot of quad to actually raise your butt off the table, so it's not really going to accentuate or isolate severely hip extension. You're not going to use any resistance, which is the key to creating strengthening. You always have to... Exercises are just mechanisms that allow you to isolate muscles so that they can then have progressive resistance applied to them, which is where the muscle adapts to greater and greater resistances, thereby making more muscle, which is what then allows the muscle to develop enough strength to where its force output is greater than the force requirement of your activities, which allows you to perform your activities without having pain. Okay? So we're not talking about doing bridges. We're not talking about doing hip thrusts. We're talking about doing hip extension if you want to be nice and conservative and safe, or straight leg deadlifts if you want to be a little more aggressive in the type of exercise. By the way, again, people will say straight leg deadlifts are unsafe. That's nonsense. Done correctly, it is probably the most effective way of strengthening the gluteus maximus and the hamstrings. But you just have to be very careful in how you do that. To show you the fact that it's safe, I do a 405-pound straight leg deadlift, and I've never had back pain. And in fact, my back is so strong because I sustain balance between my hip flexors, my quads, my gluteus maximus, and my hamstrings. All right? So, if you like this video, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe so you can get notifications when new videos are added or when I am live on YouTube. If you want to discuss an issue with me or you would like to set up a Skype or Zoom session, please contact me by email at drmitch@mitchellyass.com, Dr. Mitch, D-R-M-I-T-C-H, at M-I-T-C-H-E-L-L-Y-A-S-S.com, Dr. Mitch at mitchellyass.com. So for now, Dr. Mitch wishing you a pain-free, full of functional life. Let's resolve that pain at the back by strengthening the butt. Take care for now. Bye-bye.